Urologic Health with Dr. Ricardo Gonzalez, urologist and FPMRS specialist.
So you want to learn more about vaginal surgery without the use of synthetic mesh. Or you may ask, can I have reconstructive surgery without the use of synthetic polypropylene mesh to correct my prolapse? Absolutely. Native tissues and or biologic grafts can be used to repair your vaginal prolapse surgically. So if you are a good surgical candidate and the tissues are felt too weak to support themselves, we don't necessarily need to do that repair with synthetic vaginal mesh. There are options from cadaveric sources, so women who have donated their tissues, their fascia that have been processed, that we can use supportive tissues either from a woman's own body, from a donated source of body that's processed to remove any cells, or processed implants can be derived from fetal cow tissue, from pig tissues to reinforce any weaknesses in a woman's pelvic floor. What these grafts can do when we use them to support is provide more support than a woman would have with her own musculature. So they're to help support a soft tissue reconstruction. The body would then grow into these biologic grafts, calling in stem cells to restore that tissue to become the woman's own tissue. So we expect incorporation and absorption into the woman's body by about 3 months when we do use a biologic graft. So yes, absolutely, we can do a repair through the vagina, avoiding synthetic mesh. We can use a woman's own tissue, or we can use a graft like I just discussed, with the goal of avoiding pelvic floor mesh in women who do not want surgery with pelvic floor mesh. So what are the benefits of doing a repair with biologic graft support? Well, vaginal reconstructive surgery is sophisticated and it's delicate. The vagina is a soft tube, and if we can do the operation through the vagina, there would be no visible incisions, and it can be done without cutting the abdomen, allowing women to recover faster. Often, women are told that they need a hysterectomy at the time of their prolapse repair if their uterus is dropped. And having a hysterectomy is okay in many instances, but if women don't want that, there are benefits to not having the hysterectomy. The vaginal length is not shortened, the recovery is faster, and in women who experience a uterine orgasm, there's some evidence that not removing the uterus can allow for more satisfying sexual experience. Through a vaginal approach, supporting native tissue defects can be done by using the woman's own musculature, but again, we can also use biological grafts to improve the support at the time of surgery and hopefully improve durability of the repair so that the vaginal surgery and correction of prolapse lasts longer and hopefully is less likely to recur. And in my experience, using a biological graft provides more support than only when native tissues are used, especially in women who have already failed at native tissue repair. But again, speaking to your FPMRS specialist is a good idea about your particular problem, and you can learn more at www.hmutx.com.